welcome to the Truth Be Told podcast. My name is Erica, and this is Brandy.
Hey, everybody.
Hey, so glad you can join us. And if this is your first time joining us, we just want to let you know our podcast is focused on providing underserved, underprivileged communities, particularly communities of color, with the information and tools to help improve their dental health care experience.
Yep,
So,
yep.
on today's episode, Brandy, we're going to talk about overall health and wellness, right?
Yes, in particular, how it's linked to your dental health, but you got it.
Right, exactly. Because people don't really even realize, not taking care of yourself overall can help can affect your dental care.
Absolutely.
And you got to take care of yourself. It's a main fact. So to start off, what are some of the conditions that you can have that can affect your dental care or
So,
dental
good
health, I should say?
question. Listen, dental care, dental health is all put together in one, right?
Yes.
So, but it's a good question. But first, before I answer it, I just want to say that I think that everybody should know that your dental health, your overall health is all married together. It's all together. It's not separate. I know we have separate insurances for it, which is unfortunate, but it is all together. So to answer your question, Erica, there's a slew of things. I took some notes, so if I'm looking back and forth, I'm just kind of looking at my notes. But
You're quite
the
all
first
right.
that good, thank you, because I need that. I need the notes because I want to make sure I hit those points.
Right.
So there's some conditions. So firstly, the two I'm going to go into detail is cardiovascular disease or heart disease and pregnancy. So I'm going to save those for the end. But there are some conditions that are particularly linked to your oral health, and some of them are endocarditis. So this is an infection of the inner lining of the heart. Okay. And like I said, I'll get back to cardiovascular disease, pneumonia, if you have diabetes, HIV or AIDS, osteoporosis, and Alzheimer's. So those are some things. But there's also a couple other things. So you could, if you have an eating disorder or rheumatoid arthritis, certain cancers and immune system disorders, those can cause dry mouth, particularly Sjogren's syndrome. And I'm going to upload a little video on Sjogren's syndrome because I was asked by a viewer to go into some detail about that. So you guys will find that as well on the website.
You know what? When you said about the healthcare and the dental care and the eating disorders. So I remember, you remember the Carpenters back in the day? Remember the brother and sister, and remember she died because she had an eating disorder?
Yeah.
And I remember that was one of the things that stuck out in my mind. She had lost her teeth and things like that because of that. And also certain, if you abuse drugs, right? Because obviously you're affecting your health. You can lose your teeth that way as well.
Yeah. So with eating disorders, especially bulimia, if you are throwing up, the acids always hitting the teeth. Those stomach acids aren't really supposed to hit the teeth so often. We can always tell when people have eating disorders because on the lingual or the tongue surface of the teeth, you can tell because all of the enamel is usually worn away and just the dentin is there, which is like a yellow, softer kind of material. And it's pretty obvious when folks have eating disorders, or sometimes if you have really severe gastric reflux disease, sometimes that can also cause the same kind of thing. But usually in people who have eating disorders, it's much more pronounced. So you can tell. But yeah, you don't think about that. You don't think about it. Just us talking about it. Like if I didn't know, if I wasn't a dental hygienist, I might not know. I might not put the two together. So yeah.
I know. I took it way back with the Carpenters. If we have some younger viewers, they're gonna have no even.
Look, we staying with the old school references. Chris was getting on me the other day talking about y'all keep playing Columbo and you keep saying Columbo. I'm like, oh yeah, because so we ain't gonna use Columbo no more because apparently, you know what I'm saying, it's a lot.
People, they're not gonna understand.
Listen, if you guys get stuck on something and you're a little young, you can get on the Googler, okay?
Yeah, the Googler, the Googler, not the Googler.
The Googler and find out.
That's another sound like we old.
Look, You get right on the Googler and figure it out. But yeah, so that is something, yeah, that can definitely affect your oral health. Like I said, two and two, you would normally think that people would be able to put those together, but not always. So that's
Okay.
what we're here for.
Right.
So we can help y'all figure it out.
We digress. We digress. So move on. Go ahead. Tell us what we need to
Um,
know.
okay, so we talked about that. So the two that I wanted to really talk about in particular, first is pregnancy. So, and again, I'm looking at my notes, so forgive me, you guys. So if you have any issues inside your mouth, gingivitis, or if you have periodontal disease, those bacteria a lot of times are found in the cord blood. So some people save their cord blood for stem cell purposes, and when
Mm-hmm.
they test for all kinds of things. And a lot of times, when women have those issues and those diseases like periodontal disease, those bacteria they're found in the cord blood. Not good because you're passing those bacteria
What?
on to the
You would
child.
never know. And did the OBGYN, do they have this information? Do they tell them this?
No, no, not
See?
no, no. Nobody knows this. Unless you are doing it all day, every day, like I do. So
No.
that's why I'm in, certain ways. I'm an educator. I'm an oral health educator. So I have to, when I find out patients are pregnant, I'm just letting them know, make sure you keep up your dental hygiene, because these things you can pass on to your child, and they can also affect the birth of your child. So, meaning if you have gingivitis or periodontal disease, you can have a low birth weight baby. You're more susceptible than somebody who does not
Really?
have periodontal disease or gingivitis. Yes.
That's so crazy. One time I went to the dentist and the dentist was saying that parents tend to, you know, taste the food before they give the babies the food. And the parents were doing this with the kids and the kids' teeth were affected.
Mm-hmm.
Does that sound correct?
Well, yeah, because the bacteria is being, transferred from one place to another.
Mm.
So, yeah, so the bacteria that's in your mouth, it can be transferred to other places. That's
Mm.
for a whole nother episode.
I
But,
know it is. I know
hey,
it is. That's going to be a good one, too.
this thing. So you have to be mindful of that. You absolutely got to be
Right.
mindful of it. And like you said, when you spoon feeding your kids, like what's going on in your mouth? You think you're the
Mm-hmm.
parent or whatever you have is, y'all family, but you can be passing things on to your children.
Right.
You know what I'm saying? So
Because we would be like, oh, teeth are hereditary. Was hereditary because you ain't brushing it and you passing it on to your kid.
that, yes, that part. But that's also largely not true. It's a big misconception, but that's also
Mm-hmm.
for another episode.
I'm sure.
People always are like, "Oh my god, I got bad teeth on here. You ain't hear about teeth." Nah, that's very rare. Like there's, like please just keep up on your oral health and you be straight. Like you don't have to worry about because your parents' teeth came out, yours are going to come out. But like
Right.
I said, we're going to talk about that another time. But
Okay.
Erica, good though, good.
Okay.
Adding that. Anyway, so back to the pregnancy. All right, so we said low birth weight babies. That is a fact. Also, you can have premature delivery. So you may deliver earlier if you have gum disease, periodontal disease, gingivitis, because all of those bacteria are very aggressive. And we know they travel through the bloodstream. Like we said, they're already found in cord blood. So that's something that you're exchanging with your newborn. No, I'm sorry, not your newborn, your unborn child. You can also have preeclampsia, which I know a lot of women do suffer from. That can happen if you have periodontal disease or gingivitis. The other thing that can actually manifest inside your mouth, they're called pregnancy granulomas, aka pregnancy tumors. And they're like large, bulbous areas on your gums. So they become really red, they bleed, sometimes they get really large, and they can be all over the mouth. But it's the actual
Have
gum
you
tissue.
seen you've seen this in person?
Girl, hundreds of times.
Oh my
Absolutely.
God. This
And
is so
sometimes
crazy.
when they're really large, they'll remove them. Other times you just gotta suffer through
And
until
you're
you have,
pregnant and you have this going on top of everything else.
well, because their oral health is not being maintained. They're not flossing, they're not brushing.
What
You know what
about
I'm saying? They have gingivitis. Yeah.
what about calcium? Because like I thought about that too. Because if you lose because the baby's taking your calcium, right? And the calcium's in your teeth, right? So they
Okay,
can
so no, that's
no,
another
that's a myth.
misconception.
Okay,
Yeah, that's a
listen,
that's a
see,
myth.
that's
But
why we're
look, you
here.
learning
'Cause-
too. Look, everybody's learning because I have women come in like, oh, I was pregnant and I lost all my teeth, or my baby took all my calcium. That's why my teeth had kept. No, madam. That's not what happened, but it's okay. That's why we're here. So that all we got to do, Erica, is stay on top of our healthcare.
okay, madam.
Okay, we got to stay on top of our healthcare and make sure we're flossing, brushing. Get yourself a water pick. You should be brushing at least 3 to 5 minutes, which is roughly the length of a song. You're going to brush longer, not necessarily harder. Those are things you can do, but those pregnancy granulomas or pregnancy tumors typically resolve after you give birth.
Mm-hmm.
There's a lot more hormones going on when you're pregnant, and that, along with the lack of oral hygiene, is the reason why people get these pregnancy tumors or pregnancy granulomas. They're completely
Wow.
benign. It's not going to hurt you, but they're uncomfortable. They're unsightly, okay, because they'll bleed on their own. Sometimes they're really large. So it's a fun thing to have. And I know rarely, sometimes women have discomfort with them. So,
Okay.
um,
What's the next one? What's the next disease?
okay, so the pregnancy, we got that down. And
Yeah.
then what was the other one? Oh, cardiovascular disease. So let me see what the
Gotta
notes. So
keep
I
that
can say
heart healthy.
right. So of course, cardiovascular disease is heart disease, and so the connection between cardiovascular disease and your oral health is not fully understood, other than the fact that the bacteria that's in your mouth travels through the bloodstream. And so if it goes through the bloodstream, there's nothing to stop it from traveling to and from the heart, because your heart pumps blood to and from your extremities and everywhere else in your body.
Yeah.
Um, but a lot of research, suggests that for heart disease, you have clogged arteries, and the arteries, once they're clogged, they can cause stroke. But they're saying that sometimes the plaque and tartar that's in your mouth, especially tartar because it's hard, when it breaks off, it goes through the bloodstream as well, and that can help to clog the arteries as well, because it's like tartar is like a calcified version of plaque. Plaque is soft. You can remove it easily when you brush. If you don't remove it within 24 to 72 hours, it turns into tartar or calculus, and it gets hard. And that's when you have to have it
Mm.
removed professionally. So you can't remove it on your own once it's at that state. But anyway, so if you haven't been to the dentist in years, then you have this buildup on your teeth. There's no ifs,
Oh
ands, or
yeah.
buts. And it breaks off from time to time. Some people come in there like, oh, my tooth broke. And it's like, not your tooth, is something that shouldn't be there. So it's harder. So those things, once they break off, can go into the bloodstream as well. Very aggressive bacteria that can help to clog the arteries. Clogged arteries lead to stroke, and so on and so on. So it can
Mm.
affect your heart health. Um, it can affect your health, being pregnant. If you have diabetes, it can be worsened because of this periodontal disease, and you see it hand to hand. So typically, patients who have diabetes a lot of times have periodontal disease. When I see patients, it's
Oh.
unchecked periodontal disease. So just nothing that
Oh.
they're doing. And then also with Alzheimer's, Alzheimer's, you see those patients as their disease progresses, periodontal disease progresses. And periodontal disease is a disease that deteriorates the gum, the bone, and the tissue that hold the teeth in place. So the longer you have this disease, it eats away at the bone. The bone doesn't like those really aggressive bacteria, and it'll kind of recede away. The tooth get loose, and then you don't have a place for your teeth to reside. So you can lose them whether you have
Yeah,
cavities or not.
because
And
there's nothing to
so,
hold the teeth up, right?
what'd you say?
There's nothing to hold the teeth up if there's no bone.
Absolutely. There's nothing to hold the teeth in place. So if you
Wow.
don't have bone, you don't have teeth. And if you have teeth, they're loose. And then they're not
Uh,
functioning. And then you have
right.
digestive issues because you're not able to chew
Oh.
properly. You're swallowing food before it's completely digested in your mouth. The
Oh my
mouth is the
God.
first place you digest food. So it's a vicious cycle. But
Yeah.
in a nutshell, those are just a few things that conditions and such. And I just wanted to focus on those two. So,
Well, Brandy, you're always a wealth of knowledge. You really taught
well,
me a
thank
couple of
you.
things that I had misconceptions and,
Listen,
myths and
and
had no idea.
shutting them down.
Yeah, I'm like, what? What you talk about? All these
Shutting them
time, I'm
all the
like, oh
way
yeah, well,
down.
calcium. The babies take the calcium, and that's why, because that's what they tell people.
It's an old
But if you're,
wives' tale.
yeah, it definitely is an old wives' tale. So obviously, our time is up. You've given so much great information. So
Thank
we
you.
just want to always say thank you guys for coming to join us as well, to check us out and see what's going
Absolutely.
on every week, Fridays, truthbetoldpodcast.com. You can
Yep.
view us on YouTube, Facebook. Check us out. Brandy, do you have any final words?
If you guys have questions, you can email us at truthbetoldpodcast@gmail.com. You can ask us in the comments on YouTube. You can go to the website, truthbetoldpodcast.com, and go to the third page, the contact us page. Once you scroll past the audio versions of the podcast, there's a little inquiry page. You can type in there any questions if you want me to go over anything. I'm frequently checking that email, and ain't nobody emailing. So I'm gonna need y'all to
So
get
that means you guys, you
together.
don't be scared. We know you're scared to go to the dentist, but don't be scared to ask the questions. I know it's daunting, especially to some of the things that she's saying. Like it's like, yeah, exactly. But you don't want to be put in those predicaments. So, yeah. So our next episode is going to be about your diet, right? And
Yeah,
your
how that
overall your
correlates.
oral health and your diet and the things that you're eating.
Yep.
You know, so
Hmm.
everything's going to affect you somehow, some way. Unfortunately, if you're not doing the right thing. So, all
Yes.
right. So
Don't
this is
forget
a
to subscribe to the YouTube, follow our socials. We're
follow,
just trying to
share,
get
and
on.
like,
Follow, share, like,
share, and like.
subscribe, all that, all that.
All right. Thanks so much, you guys. Till next time.
All right, take care.
All right. Bye.